So Dr. Rohan and Dr. Jagdish, so how is your preparation?
Going on, sir. Like, very tense actually.
Don't strain too much. I think don't strain too much. Now relax for the next 2 days. Good, just to read do only brushing up or something like that.
Yes, yes.
I was trying to log into Facebook.
We can start today.
Yeah. We can start. Good evening, everyone. Welcome to ISG K PG Clinics. It has been almost 8 months since we started this on January 17th, and we had a really hectic schedule. We had 48 sessions, of which 46 were clinically oriented. Only 2 were actually a topic, that is research topic by Professor Narendranath, and on a randomized control trial, 2 journal topics and 1 journal topic and 1 research topic, and the remaining and the initial one was on clinical examination by Jayanti ma'am. It was also clinically based. So we had, in fact, we had 46 case discussion, and because of the OSCE, we had, I just counted and found out that we have discussed more than 100 case scenarios in the last 8 months. I think covering almost everything possible in this period of time. I am sure our students would have benefited a lot, and personally observing, I have noticed that their standards have improved tremendously over the last 8 months, and they have become very confident, and they can face any questions, any type of cases. This is all possible because of the initiative of the president of ISG Kerala chapter, Dr. Prakash Sakarias, who actually wanted a session like this to be conducted. However, I would like to thank all the faculty members who have taken their taken their time out to join the clinics and taken active and part in the conduct of the clinics. Without the cooperation of our senior faculty, this would have been impossible. And we have even the most outstanding faculty for this group was Jayanti ma'am. Jayanti ma'am had her own group in Chennai. She was doing this sort of clinics for the last 1.5 years, ever since Corona started. And once we started the intensive sessions since April, ma'am has joined us on a regular basis. And in fact, actually a combination of Kerala and Tamil Nadu group together doing the class on Tuesdays and Thursdays. It is all because of ma'am's cooperation that we could do all this in a wonderful way. And I should also not forget to thank Dr. Venkatakrishnan, who has been extremely helpful. I would say very, very helpful in conduct of the clinics. Whenever I have requested, he has agreed to do that. And other outstation faculty like Dr. Sethu Babu, Dr. Usha Datta, and Dr. Rupa Banerjee also helped us in conducting the clinics. Our all Kerala faculties, Narendran sir, Shanai sir, Vinay Kumar, and all senior consultants from all private hospitals and corporate hospitals where DNB is done, all have cooperated very well. I think I have to say a big thanks to all the faculty inside and outside Kerala for having done such a wonderful job. And most importantly, these clinics would have been useless if the students were not there. So due to wonderful participation of the students and residents and their discussion and their enthusiasm, we were able to do this. There were days when there were more than 140 people listen to our program. The average was around 100 to 110. Okay, there were only 33 students in DNP students in Kerala, and the remaining were all from Tamil Nadu and the rest of the country. Our Facebook group was, as it stands today, around 278 members watching the program regularly, and because the records are available, and almost all the program I have recorded and put it on YouTube, and the link is put in the Facebook too. So people who want to come back and look it also can look at it. So there is a good tremendous response to that as well. So apart from the live Zoom clinic, these clinics are available in a recorded way in the Facebook as well as in the YouTube as well. Okay, so with these words, I like to thank all of you and invite the President, Dr. Prakash Sakarias, to address the gathering and see encouraging words to the outgoing students and also welcome the incoming students.
Thank you, Professor Varghese Thomas, who have been the pillar of this ISG Kerala chapter postgraduate clinics. So, respected senior teachers, Professor Jayanti Madam, Professor Chennai, Professor Vinay Kumar, and all the senior teachers who have logged in, students, senior consultants, everyone. This is directed especially to the postgraduates. Before I say something, I should say that I myself has learned a lot from this teaching program. We had such great teachers who came in onto one single platform to teach. We had Professor Jayanti Ma'am, whom I would say is the Dronacharya of teachers, of gastroenterology in India.
Oh.
We had all these great teachers, Professor Venkatakrishnan, Professor Krishnadas, Professor Vinay Kumar, Professor Ashok Chakko, everyone. So I could listen to many of them whom I haven't heard before. So the DNB courses are offered in different centers in Kerala and in other states also. So actually, ISG Kerala chapter conceived this idea of PG clinics to support the academic program of postgraduates, especially the DNB trainees. And for that, we are extremely fortunate to have Professor Varghese Thomas to spearhead this program. I am really tempted to say that the final year batch of DNB, or rather the exam going batch of DNB this year, would be one of the best academically trained or tutored batch in recent times to take the exam. Dear postgraduates, you have been really fortunate to be part of the teaching program conducted by one of the best teachers in the country, Professor Varghese Thomas. You had also the opportunity to be trained twice a week by a galaxy of great teachers whom I had already said, especially Professor Jayanti Ma'am, who have been a presence in all the teaching programs. I don't know, such dedicated teachers we may not see so many, but we had all these teachers, Professor Narendranathan, Professor Chennai, Professor Vinay Kumar, Professor Ashok Chakko, Venkatakrishnan, Professor Krishnadas, even senior consultants like Dr. Matthew Philip and Dr. G.N. Ramesh, and a host of others. So be confident that you have received the best academic training. Now it is a time to sit, relax, and brush up your memories and go through your notes which you have already prepared. While facing the exam, be confident as you are the best prepared person there. Never panic. Never be overconfident also or arrogant. And never argue with the examiners. Remember all the tips which are given by the teachers. I'm sure some of the teachers who are already here would give you some more tips. Stick to the basics. A good history and a good summary would make a good impression on the examiner. While considering a diagnosis, remember that common things are really common. I am sure all of you would do well and come out in flying colors. On behalf of ISG Kerala chapter, I wish you the very best for the exams, as well as for the future. I also welcome the new final years for an intense teaching program in the coming year, which would start soon. I'm sure Professor Verghese Thomas has already put up a great program for you. So best wishes again from ISG Kerala chapter to all of you. Thank you very much.
Thank you, Dr. Prakash. That I am sure will encourage our students, and it has been a supportive message. I request Jayanti ma'am, the senior professor of hepatology at SRMC, and well experienced, well known, most sought after teacher in India. Jayanti ma'am, your words.
PT and good evening, Dr. Prakash, and good evening to all the senior faculty members. I think Dr. LBK has not joined, so I think the first and foremost is I think the journey actually starts in 2011 or 12 when I went as a first DMD examiner, and I found that only 1/3 was passing. You know, if you have 16 candidates, there were only 3 passes. That was the first time I sat in the examination hall, and lo and behold, that was the fate of the students. And then started the student move, you know, when they said that now we have to start learning, and they started moving in. So the batches from 2011 onwards would come in 2s, they'll come in 3s, and they'll come in 10s, and they started in 20s, and then it went to 90s. And we would have huge sessions at Global Hospital for almost 8 years, once a year. And it will be a 2.5 days marathon session. We'll have about 16 to 20 cases that are discussed. Of course, not everything by me. I'll have a great support by a pediatric Dr. Malti, and then we had Dr. Sharavanan from surgical gastroenterology, radiologist, endoscopist. And it was one of the best times, you know, when I used to confront the students, and I would not know anyone. I would not know who they are. All Gujaratis and Maharashtrians would look alike, and I would be sitting sometime as an examiner. And when they're present, you would suddenly hear the people around you, you know, kahan se aa raha hai? Don't know where these boys are coming from. Must be from a teaching institute. You know, that's the Bombay. Oh, he must be from Hinduja. Is this from Bhopal? Oh, he must be like. So the comments were very, very soothing, you know, and I would just keep quiet and listen, you know, and just say, okay, that's good news for me that things are going well. And so this is how it happened. And then, of course, the lockdown came in, and the local people in Chennai would come home, you know. So I always had about 16 people at home on Sundays. It was one, I mean, I love teaching, so I don't know what I teach, I do not know. I just enjoy teaching how to take clinics, how to discuss cases. And we'll have sessions on Sundays between 11 and 1, and this will just continue. And of course, when the lockdown came, I really did not know what was to be done. So I started in March, on March 17th, I still remember the date. And then we started on March 17th, and we had a lot of guest lectures till about September. Then I got LBK, I moved him into, by the end of June, July, I got him into our group, and we called it as a PG Clinics 2020. And then we had about 187, 210 students, and then started the wave. And then, of course, as we continued, it is, I think the students should understand that it is not easy for the faculty. You know, every PowerPoint presentation was edited by the faculty. And it would take 3 days, 4 days, 5 days to edit, contact the student, get back the reports. LBK was doing from his side, I was doing from my side. And then I found that it was becoming, you know, and I think it was God sent that VT suddenly said, can we have a combined session? I think that was God sent, because I was having real difficulty in coping up with the classes as well as the PowerPoint presentations. And then we decided that we joined because it was becoming too many sessions. Already we had decided Tuesday and Thursdays. We had Thursdays. We then decided, I think that is too much. Beyond that, to have a separate session from my side, I thought that was the end of it. And best was to join up. So we decided to join up. ET and I had a discussion, and LBK also we decided. And we said we have a combined session. A lot of Tamil Nadu faculty members wanted to join. To me, it was faculty members sometimes when too many are there. You know, sometimes they keep questioning, cross-questioning. So I just told our secretary that it will be only me and LBK, and that will be the faculty, that's all. So that's how we joined the Kerala group. And I think Kerala chapter has done a wonderful, wonderful job. PT, thanks, hats off to you, because you took off my responsibility, you know. So the PPT was being presented by Verghese. I had no problem. Occasionally, I would have few cases presented from my side. LVK was phenomenal. He works till 2 a.m. at night, and despite that, he has his PGs doing the PPTs. It is not easy. It is absolutely not easy for the faculty. Professor Vinay Kumar, Professor KT, all of them. I know It is not easy at all. For those who are listening, some of you are lying down and listening, some of you are enjoying and listening after the session. But people like us who are there live, sitting with the sessions, we know how much stressful it is for the sessions to go on. So I think the Kerala chapter, along with the PT clinics, then it became 2021. Now we're introducing the PT clinics 2022. Already students have gathered into that group. That group will now join the Kerala chapter, and then we continue. The few things is the pattern of exam this time is OSCE. So you have your OSCE first, and then you go through your ward rounds, which is 4 cases. Just a few tips. You can just imagine what will be the ward round cases. No, it will either be corrosive stricture, it will be something that does not require history taking, a splenohepatomegaly or a patient EHPVO, or it will be, they'll say it's an incidental HBV. It will be that type of a case ward round. It will be very, very short. They're just 4 short cases where you're actually confronting the examiners. So lucky are you, the COVID group and this group are the lucky ones where they're not going through the conventional exam, where you need to take history taking. And what I thought is from these sessions, apart from, for me, it is not passing the exam. For me, it is for you to be trained so that you leave and become a consultant. So the 3rd of September, you're all going to become consultants. You should know how to manage a patient. You should know how to examine a case. You should know how to take a good history taking. That's the main thing. And the last session of that particular OSCE, that DNB exam would be 2 cases are coming from the DNB office. Last time when I went, it was ischemic bowel. So what I realized is they're taking some unusual cases. So like for instance, you may get a hemochromatosis, which we don't discuss, or you may get a short bowel syndrome, which we don't discuss. So to me, I feel, or pregnancy and liver disease. So I feel that the two, this is my guess, my gut feel is usually very strong. So my feeling is that the 2 cases that are going to come from the DNB office will be something unusual. It will be out of the box. So please just brush up those chapters where you find that you may need a little more brushing up, say ischemic bowel, short gut syndrome, hemochromatosis, certain things that we cannot cover because we don't see those cases in our day-to-day practice. So with these few words, I'll just continue and absolutely just blast off. Okay, you all will do very well. Try to score the maximum marks in OSCE. If it was a 150, try to get your 120. To get your 120, then you need just about 80 or so from the rest to pass the exam. And that's how last time we got, the highest was 73, 75%. Can you imagine in a practical? 75% was the highest. 75, the other candidate got 1 mark less. So all the best wishes to all the people who are appearing for the exam. Wish you all the best. God bless. And I'm sure you'll all come out in flying colors. Try to, everything you recall. You say, oh, this case was discussed. And this is what the answer is. And we welcome the new batch which is coming in. And the plan is that at least for September, it will be Tuesdays. 1st and 3rd Tuesday will be by Kerala chapter. 2nd and 4th Thursday will be from LVK and from my own self here for September. And then we decide how we move on in August, because you people will be appearing for hearing December. So the takeoff for the clinics will be sometime in January. Until then, we just hold on until October or November. Okay, with these few words, I wish all the students who are appearing for the exam, on behalf of LVK, okay, he's being my mentor, okay, on behalf of LVK and my own self and the entire faculty of Kerala chapter, hats off to all of you. We wish you all the very best and do very well. All the best. God bless.
Thank you, ma'am, for that wonderful support and words of wisdom. Thank you once again. Now I request Professor Vinay Kumar to come over. Professor Vinay Kumar, please.
Good evening, Dr. Prakash Sakriya, the ISG Kerala chapter president, the course director, Professor Varghese Thomas, Jayanti ma'am, and the senior faculty. I don't know whether Sharon sir is here or not, and dear students. As already actually mentioned to you, by all the faculty, I think it's a wonderful initiative by the ISG Kerala chapter by Dr. Prakash Sakriya to have this sort of a format for training for DNB students. And I also felt that, such a training is really required, because if you just look at DM training in the various centers, this is structured, and Medical Council, in fact, is keeping a more rigorous eye on this training program. And but the DNB students, if you just look at the standards of training, and when you sit as an examiner, we feel that the standard of the candidates are also actually quite varying very much, among the different centers. So this sort of a training, a common training, a platform is really required for the unification sort of thing, So that is very wonderful. And then it is actually the done to perfection by the course director, none other than Professor Varghese Thomas. So I think it's a Herculean task. It's something very much welcome, but I think it's very responsible task. I think hats off to you, Professor Varghese Thomas, for doing this sort of wonderful thing. I know how much stress this is going to be. So for conducting this sort of program daily and on a regular basis. So I think that's wonderful. And to the students, well, as already mentioned, this is one of the lucky batches, because you have real training, a structured training. And Professor Varghese, when you look at the agenda, I can see that, you have a complete coverage of the topics. If you just look at the cases being presented, so I've been involved in some of the cases, but then I've been watching other cases also, and then I can see the sort of coverage that you have done. So I think these cases are not actually casually selected. This, in fact, he has got an idea, and he actually he's keeping the track of things and see that the cases, in fact, there's a complete discussion about the different sort of cases. So that's actually wonderful. And one thing I would like to highlight is that this Zoom platform is actually wonderful. We are actually exploring the possibilities, wonderful possibilities of the online meetings and Zoom platforms. Wonderful. I think it's more wonderful than we thought. I think we definitely will be able to have distant education more effective manner. So which we have appreciated. It's wonderful. But I can tell you that about the clinical examination, very important aspect is about the patient interaction, physical examination, and sort of thing which probably you will not be able to get through this Zoom platform. So beware of that sort of a deficiency. But then the COVID time examination, it makes actually things easy for you for the examination aspect about that. This interaction with the patient may not be there to a larger extent, only again through these presented cases. And the COVID time examination, I feel that, just looking at the results of the various examinations, right from the SSLC examination, MBBS examination, and the PG, basic PG, and super post. If you just look at the results, I've been following that. It's wonderful. So I think the examination aspect, you may not have that much of hiccup. But then my advice will be that beware of this sort of deficiency that, examination aspect, directly, physical examination aspect, history taking directly, this is a very important aspect. And so after you pass out, it may be a good thing, which comes to my mind is that, stay with, a senior person or a group of practitioners for some time. And then you consolidate your ideas before you start your practice independently. So I think the examination gives, in fact, what is given to you. But then, but be very natural, and this mostly theory oriented, this exams, OSCE exams, with the cases being presented to you, and then mostly, especially when you have your entrance examination, the same sort of, question format, and you make yourself eligible for the course, the same sort of exit exam will be facing. And then I don't think you may have difficulties in this sort of OSCE exit examination. So, well, my best wishes to you. Be very confident, as is already actually told by the president himself that, you had your best training possible under the circumstances, and be very confident about that. And I am confident that, well, you will be doing wonderfully well. So my best wishes to you. Well, we are expecting, another batch, again, the second exam going batch, and then you can also have a very structured programs for you. Well, we definitely will be able to exploit and explore the Zoom capabilities. But then, the COVID time will be actually probably more kind after some time. And then we may be able to, as I have actually told you about the current lacunae, the physical examination aspect about that, we may be able to conduct the regular offline meetings or also, the examination, the clinical discussions offline also, at least sound-wise, and ensuring good participation and better clinical understanding, at least for the next exam-going students. And probably you may not be as lucky as to have online exams, when you have your exams later. And probably we may be able to prepare you for that sort of format also, And I'm very glad that, Professor Varghese Thomas is already having schemes for you. So I think with that, I welcome the new batch, but we all look forward to Professor Varghese Thomas for his schemes and plans. So, and again, I need to thank the faculty, both from Tamil Nadu and from Kerala, who have supported this ISG program. And then I think it was a very wonderful experience altogether, both for the faculty and for the students. And well, I congratulate this leadership for taking up this wonderful program. So with that, again, my best wishes to all of you, and my sincere thanks to all this, the persons who matter, who made this in fact possible. Thank you very much.
Thank you, Professor Vinay Kumar, for that wonderful address. Covering all aspects of training. In fact, we had a couple of discussions regarding the deficit of our program, that is lack of physical examination and ability to. In fact, we wanted to have, we even thought of having a physical examination at Cochin and even at Trivandrum also. We thought of having it, but then the COVID, I think, completely smashed all our thoughts and plans, everything. Okay. Now, I welcome Professor Venkata Krishnan, who is online. And Professor Venkatakrishnan has been such an immense support to our group, and I would say with such phenomenal knowledge in hepatology. Phenomenal knowledge, I would like to say. And I have enjoyed each and every session of Professor Venkatakrishnan. And his cases were phenomenal. Okay. In fact, I was discussing with him that he should make a handbook of how to do clinics or how to approach a problem, because such are the wonderful cases which he has presented. And fresh cases, completely worked up. And in fact, when I had to present a case of diarrhea at the ISG National Forum, I went through the discussion of his with the reference on diarrhea to get new points. Okay, such useful are his clinics. So welcome, Professor Venkatakrishnan, to address our all students who are preparing for the examination, as well as to greet the new students or incoming students. Professor Venkatakrishnan.
Thank you, sir. Thank you very much. First of all, I think I should thank Professor Jayanti Madam for first having initiated me into this curriculum. I also thank the ISG K, Indian Society of Gastroenterology Kerala chapter, for having given me opportunity to take pretty number of classes, I think, and I also really enjoyed teaching and probably discussing these cases. Thankful to you and everybody, all the faculty of Kerala ISG, and especially Madam Jayanti for having introduced me into this, inducted me into this group. To be fair, I think I really enjoyed teaching all these classes and put in a lot of effort to do this. And I hope these classes were very beneficial to the students of DNB. A bit of nostalgic thing, this because I started my training in gastroenterology in Kerala. I was colleague of Dr. Prakash Zakaria at PVS Memorial Hospital. Before I just worked in PVS as a registrar before we went into RDM. So, but for a few years, I was also a member of ISG. And I wish all the students very best. I think they should be doing well in the exams. We did take them through a phenomenal course of exercise and case discussion. And I hope they do well, and I wish them all the best in their exams as well as in their careers and in future. That's what I think I want to tell them. Just stay cool and then do the exam. I think most of it has been covered in our sessions in a very, very structured manner. Thank you, sir. I thank you, all of you. Thank one and all for having given me this opportunity to be a part of this program. Thank you.
Thank you, Professor Venkatakrishnan. You have been a wonderful teacher. You have been a wonderful supporter and a great teacher. And we all look forward to your further support with wonderful cases. And please consider my suggestion of writing a handbook of grand rounds. I think all the senior teachers can chip in with their cases and how it is to be discussed. We have the records and we can edit those discussion, and in fact it will be one of the most sought after books by the DNB students. I am sure about it. I think we have to put in extra time.
They're already initiating it, yeah.
Yeah, once somebody initiates, I think it should happen. Thank you, Professor Venkatakrishnan, for addressing the students. And I now invite Dr. Matthew Philip. Camera still okay.
Hello, very good evening, and thanks a lot for asking me to say a few words on this occasion. I think first of all, I'd like to congratulate ISG K for organizing such a wonderful thing, and in fact, creating such platforms for students, make a uniformity of training among students. That is very important. So, you know that training could vary from institutions, and this type of forums really make students at least some aspects of training more uniformity. So I think it was a wonderful idea, and congratulate ISG Kerala chapter, especially Prakash Zakaria, and the key person Varghese Thomas, and he has brought in so many great teachers of Kerala as well as outside Kerala. So it was a wonderful session. And in this occasion, I really wish all my younger colleagues all the best. So do well in the examination. You have got a wonderful opportunity to learn, and I'm sure you all will do well. So nothing to worry. All the best.
Thank you, Dr. Matthew Philip, for that supportive advice. Dr. Premlada, are you there? Dr. Premlada? Dr. Premlada, please switch on your video as well. We are not able to see you. Okay, please. I think the light is affecting your. Okay, you can address us. Dr.
Okay, thank you, sir. Respected teachers, colleagues, and dear students. And first of all, I express my gratitude to Varghese sir for your continued dedication to this PG clinic. And in spite of this busy clinical work schedule, and it was really helpful for students, PG students, to discuss and learn cases from senior faculties like Jayanti ma'am, Venkateshan sir, Narendran sir, Shenai sir. And also I like to appreciate the senior faculties for their efforts to highlight the important aspects of clinical cases. And I'm sure this will help the PG students to perform better in their examination. And I wish all the very best to all the students who are appearing for the upcoming examination. Thank you, sir.
Thank you very much. And the coordinators for the last batch was Dr. Vivek Joshi from Chennai and Dr. Sujit James from Medical Trust Cochin. Dr. Vivek, are you there?
Yes, sir.
Just a few words. After that, Professor Shenai. Professor Shenai, sir?
Yes.
Okay, please. After Professor Shenai, sir, Vivek, please address. And after that, Sujit. And after that, Srividya, please keep a list of the new students and we'll call them one by one by name. Shenai, sir, please.
Let me thank Dr. Varghese, Dr. Prakash for having this wonderful program. I think over the last couple of weeks, we discussed many cases, OSCE, and other types of presentations. I am sure that the students will do well. As an examiner, examining the DNB students in the past, what they wish to examine is what you know rather than what you do not know. So I would request each of the candidate to have the presence of mind to listen to the examiner as to what is the real question which examiner asks rather than replying something back. I think I have been seeing this over and again that you ask a question and the reply is or the answer is something else. So keep your mind steady, and the current examinations are only 1/10 of what is the real DNB exams. The chance of getting a clinical examination has been reduced to 10%, which means evaluating the skill of the candidate is only 10%, and the probability of passing is 90% compared to 70% earlier. When you spend less than time with the examiner, the chance of passing is very high because you cannot expose your ignorance. I think one of the things which I see in the current DNB exams is the skill evaluation has been practically zero. And most of these things are in the form of OSCE, which you have some 25 questions and 6 marks for each, 4 minutes for each OSCE. And you have to have a real presence of mind to look at each of those diagrams, figures, or charts and give the response. For example, let me tell you something. If I project a picture of a dermatitis herpetiformis in a young female who has come with a chronic diarrhea, weight loss, and if the next question is, what is the disease with which this skin manifestation is associated? And what is the likely genetic basis? Or are there any genes involved? If a candidate writes eczema and writes seborrheic dermatitis, I think he gets 0 marks. So if he has to get 4 marks, something like 6 marks, he will get only 0 marks. So the chance of scoring in the OSCE is quite high. In fact, you will cover up all the deficits of a communication skill which is being assessed during the skill evaluation. I believe there is no skill evaluation. I'm very frank about it. No skill evaluation in the current DNB examination. Very little, 10%. You cannot also evaluate the communication skill, the cognitive behavior of a candidate, the approach of a candidate, or how he deals with a problem. I think all these things are to a great extent missing, and the chance of passing is 90% unless you really want to fail. This is all which I want to tell each one of you. So keep your presence of mind. Look at each of those questions carefully, and if your response gets wrong, all the other answers will be wrong. I had an experience of conducting a DNB FAT exam yesterday, and I projected a couple of, what I tell you today is what the slides I projected yesterday. I think none of them caught this point. There were vesicles, a classical skin lesion, which I actually took from the web, a classical dermatitis herpetiformis. So I think what is required is looking at each and every one of those figures, images, or whatever statements given, and be clear. I put a specimen of Whipple's disease, a Whipple's surgery, not disease. A CCP with a malignancy, there is a gallbladder, there is a pancreas, there is a stone protruding out from the pancreatic duct. There is the duodenum, small jejunum, and all the stones which were removed as actually put as a figure, as a line. I found that the response of the candidates has been really dismal. So I think what probably they don't understand is what is the type of anastomosis done for a Whipple's surgery. How many anastomoses are there? The question was how many anastomoses will be there. So what I am telling you is OSCE is very difficult to prepare. It should be without any ambiguity. It should be clear, projected with a very clear visibility, and everyone will have an equal chance of seeing the slides properly. Timing is also very appropriate. But I think it is because either they are not aware of these conditions, or you don't think that such conditions will be asked as an OSCE. So I wish that each of the candidates who are going for examination must be very clear, because I believe that approximately 40 or 50% of the marks are covered by OSCE. The chance of passing is quite high, because I don't think there is a provision by only looking at the communication skill, which is a very short time, you can assess them well. But in a clinical examination like the DNB or DN, which every one of us have undergone, there is always an opportunity to look at various faculties, your cognition, your communication skills, your attitudes towards patients, how you approach a problem, how you arrive at a diagnosis. I think all of these things are missing, and the chance of a candidate probability is something like 9:1 to pass than to fail. Thank you, Dr. Varghese, for this opportunity. What I have given you is exactly what I have seen yesterday.
Thank you, sir. Thank you very much. In fact, that notes a little bit of tips to the students also. Brush up your knowledge about that pictures. Dr. GN, are you there? Dr. GN Ramesh?
Dr. Katie, whatever you said was absolutely true. No, clinical skills are out now.
Dr. GN Ramesh? GN was there for a while. Okay, I now request the two coordinators, Dr. Vivek Joshi, to address. If you have anything to tell us.
Yes, sir. Good evening, sir. Good evening, all the faculties. Sir, I would like to say that it has been really a wonderful session for all of us, all Tamil Nadu students, even all over India, almost from all other states also people have joined. And I would like to thank Jayanti Madam, Varghese sir, LVK sir, and all other wonderful faculties who have taken this responsibility of teaching us well and brushing up our knowledge. And it has been, sir, like a dry run of OSCE sessions as well as clinical case presentations, which is really going to be helpful for all of us in our exams, sir.
Relax well, don't worry.
Yes.
You are all confident. Okay, thank you very much for coordinating. Now, Sujit, are you there? Sujit was coordinating for Kerala. He is not exam appearing. He was second year at that time, and Sujit was coordinating. And both Vivek and Sujit have done a wonderful job. Sujit, are you there?
Yes, sir.
Okay.
Good evening to all the teachers and to all my colleagues. I would just like to thank all our teachers on behalf of all the students. Just thank you so much to all our teachers for especially taking the effort and time for teaching us so much. And thank you, Varghese, also for giving me this opportunity to be the PG coordinator for Kerala. Thank you.
Thank you, Sujit. Now I request Dr. Srividya Pillai to come in. She is the new coordinator. and she will introduce herself and also call out the names of her colleagues, and they will introduce themselves. Dr. Srividya.
Hi, sir. Good evening, everyone, and respected faculty members. I am Dr. Srividya. I am from Lakeshore Hospital, Cochin, and I am from the next exam going batch. And actually, we are so much fortunate to have this much of classes, and we are looking forward for our next sessions. And let me introduce other members which are next exam going batch. First is Dr. Binila from Pushpagiri.
Binila, are you there?
Yes, sir. I'm here.
Okay.
Dr. Abubakar from MIMS.
Binila, can you switch on the video? We should be seeing you at least in the railway station or in some hospital and recognizing you, or in the
Good evening,
airport.
sir.
Okay, welcome. All the
Okay, thank you,
best.
sir.
Okay.
Dr. Abubakar from MIMS, Calicut.
Dr. Abubakar, are you there? Okay, it's not there. Call the next person.
Dr. Karthik from Believers.
Karthik Reddy.
Yes, sir.
Okay, next.
Dr. Suresh from Believers. Dr. Amit from KIMS Trivandrum.
Amit is here. Amit. Amit. Is not seen. Okay.
Dr. Majid from KIMS Trivandrum.
Good evening, sir. I'm here.
Okay, can we see you?
Thank you, sir.
Okay,
You have
okay,
been very
welcome.
fortunate.
Welcome. Okay.
Thank you, sir.
Dr. Anup from Amala.
Good evening, sir. I am here.
Okay, welcome, welcome. Dr.
Thanks, sir. Thanks.
Dr. Deepti from Amala.
I think she is not here. She had some emergency at home.
Okay, fine.
Dr. Arunava from Gokulam Medical College. Dr. Arunava.
Okay.
Dr. Deepak from Aster.
Deepak Bangale.
Yes, sir. Deepak.
You are there? Deepak, are you there?
Yes, sir. I am here.
Yeah.
Can you hear me, sir?
I can hear you, but can't see you.
My video is on, sir.
Okay, okay, fine.
Yeah.
Welcome.
Thank you.
Dr. Ritu from Lakeshore.
Dr.
Actually, she
Ritu
is
on duty.
so she is actually her exam completed, theory exam. Now she is waiting for practical in December.
Okay, fine. Okay.
And Swaran from Medical Trust.
Not there.
Lastly, Dr. Sujit, already Dr. Sujit from Medical Trust.
Okay, so welcome all the incoming exam, next year exam going batch. And the pattern will be as Jayanti ma'am explained. Until your theory exam, we will be conducting once a week clinics, the first and third by the Kerala chapter, and the second and fourth Thursday. So there will be a difference. So Kerala will do it on Tuesday and Tamil Nadu do it on Thursday, and second and fourth. So you'll be having once a week session. And after,
the Tamil Nadu session will be at 9 p.m. Okay.
Yeah, it's be at 9 p.m. Okay. And after a couple of months, once the initial part is over, we may think of amalgamating. Most probably after theory examination, when we have intensive session, at that point of time, we may have much more closer clinics, and we will be conducting it together. Okay. And in the meanwhile, we may also plan to have a journal clubs on some other topics or important approach to problems, depending upon the popular demand. Okay. And the request is that you please read the theory, please take clinics and try to present locally in your hospital. And please go behind your faculty and make them take clinics for you. That's my request. Okay. And sit as much as possible in the OPD as well, where you make a faster diagnosis with very little history.
And
So
the plan is the candidate will take up the case on their own,
Yeah. The plan will be that it will be a conventional clinic. They will take the clinic cases, they will prepare the PowerPoint and give us at least 1 week prior to that so that we can send it across to the faculty concerned and they can look at it and advise corrections of any clarification, etc. And if possible, let us know earlier itself because certain faculty would like to discuss certain cases because depending upon their strengths. Okay, and they'll be happy to discuss certain problem which they are very strong in knowledge or research, etc. So please prepare the cases in advance and let the cases be all completely worked up cases. It is really not just history and physical finding and we don't know anything. At least the basic investigation and endoscopy, imaging, everything should be available so that it will be a very useful experience. So we all look forward to such wonderful cooperation with the incoming batch and we will continue to strive to teach you as much as possible to our fullest extent possible. GN, are you there? GN Ramesh?
Dr. Dheeraj will be coordinating from the PG Clinics 2022. Okay, global changing.
Okay. I think with these words, it is. I think we will close the session now, and it's not time. We will have regular clinics from next week onwards. Next week, Professor Vinay Kumar will be taking clinics. It will be a conventional clinics on the next Tuesday at 8 o'clock. So Kerala, it will be at 8 o'clock. Tamil Nadu, it will be 9 o'clock. 9 o'clock on Thursdays. Okay, please remember it. So with these words, I want to thank all the faculty members once again. I again want to stress that these clinics have been possible only because of your cooperation and help. I was just a facilitator. I was just sending messages and calling, but you are doing the job. Okay. And so once again, thank you, Jayanti ma'am, Professor Venkata Krishnan, Professor Ashok Chako, and all senior members of the faculty from Kerala. Shernai sir, Professor Vinay Kumar, Professor Krishnadas, and the senior faculty members from corporate sector, Dr. G.N. Ramesh, Dr. Matthew Philip, Dr. Prakash, everyone has chipped in. So it was a cooperative effort. So I think the credit goes to my what I want is a 100% pass for all my students. That's what I want. With these words, we'll conclude the session. Wish all of you the very best in your examination. Be cool. Don't worry, take it very cool, relax, and appear for the examination. Good night, all of you.
Good night. Good night.
Thank you.
All the best for everyone.
Bye, Matthew. Bye.
Hi, Jayanti, how are you?
Bye.
This Zoom platform has been useful to improve personal relationship as well.
No, I think, this is much better. No, we see more frequently than what actually we see, no?
Yeah. Earlier it was physical meeting once a year or twice a year. And even if we read there, we may not see them. Now online, we're able to see. And I would like to thank Dr. Ajit, who has been doing a wonderful job in posting articles. I think Ajit is our chief librarian consultant of ISG Kerala chapter. Dr. Ajit is online. Can you say a few words, Dr. Ajit? I always wanted to ask him from where he gets such a wonderful articles in such a short time. By the time the session is over, Dr. Ajit would have posted so many great articles.
Thank you, Ajit. Yeah, it's really good.
Ajit, and those articles have been extremely useful or forwarded to all over India, I would say, through our PG clinic groups. Okay, with these words, we will conclude. Good night to all of you.
Thank you.
Bye. Thank you, Dr. Prakash. Thanks, everyone.